If you've gone out and played a round of golf and now you have a pinchy low back on one side, I'm going to show you how to correct it before it becomes a bigger problem. Hi everyone, Tom Swales here, Advanced Movement Therapist. Today I'm going to show you how to correct your pelvis with one exercise after performing some kind of rotation sport. So now that we're in golf season, we're seeing clients coming in, they're playing more rounds, and because they rotate to one side predominantly, it can create some irregularities or asymmetries at the pelvis, which then can affect the low back, the neck, and up and down the kinetic chain. So with this one exercise, you can very quickly set the pelvis so you can go out and play your next round and potentially prevent any other injuries from happening. So before we do anything, we're going to do a self-scan, and we're going to do a couple components of the global movement scan, that being global flexion and global extension. So standing with your feet together, you're just going to simply bend forward and touch your toes. We're going to look for tension on the backside of the legs. If you feel tension on one side more than the other, I want you to split it. So you're going to kickstand one leg, come on down, and see if one side feels different. Okay? So you'll see that my right side, I've got a little bit more range on that right side than the left side. And when I do global extension, I'm going to stand with my feet together, arms up overhead. There's a little bit of a pinch on my left low back. So that could be an indication that my innominance, my pelvis, is a little bit twisted and the left side may be a little bit more forward, which will then create more extension on that left side and compression potentially on the spinal architecture or the neural structures. So to correct this, we're going to simply just use a chair, grab a ball or a yoga block, and we're going to place this between the knees. Now, I want to take an angle just below 90 degrees so I can really work on the hamstrings at a specific angle of weakness. So as I prop my feet up on the bench, I'm going to gently set the core with a breath so I flatten my back into the floor. I'm going to squeeze the ball or the yoga block with my knees. I'm going to do a 2-inch bridge, so I'm just lifting my hips slightly up off the table or off the floor. Now with the hips, I'm going to scissor them. So my left low back is the pinchy side, so I'm going to push the right knee up towards the ceiling and think about sucking that left hip into my back pocket. Now I'm going to turn the left foot in to bias more of the adductors and the hamstrings on the left side. Now once that's all set, I'm just going to pick up the right leg. So you're going to feel a little bit of a burn, you're going to feel a little bit of not a little bit, but a lot of muscle tension on the inside thigh. And we're just focusing on the breathing. And we're going to do a slight sit-up towards that same side to get the obliques to really lock that low back in. So what we're doing is we're kind of scissoring the hips. We're pulling that left hip into the socket. But what we're also doing is we're using the hamstring group and the adductors to help set the pelvis backwards a little bit. So if it's stuck forward on the left side, it's going to cause a pinch. So we're going to use the muscles to pull it backwards. And once it's burned up, once you can't really hold it anymore, just give that a break. Try it on the opposite side, set it all up. And if that everything's set and everything's firing up properly, it's going to feel pretty easy. So you're going to feel a strength difference left and right, even on that symptomatic side. Now that that's all set, let's come back to our two components of the global movement scan. Toe touch, come on down. Okay, right and left feel better. I'm going to kickstand that. Left foot to the floor and right foot to the floor. And then we go do our global extension and the pinchiness is gone. So this is a very quick and easy self-assessment format that you can just use 2 movements to see, oh, does one side feel different? Am I getting pinchiness? And it's really important because golf or any kind of rotation sport is going to create some asymmetry because we're rotating a lot to one direction and we start to get a little bit neglected and restricted to the other side. We can do rotation exercises to that side, but more specifically at the pelvis and the back, this is a great exercise to do that. If it doesn't correct your issue, you may need to seek further intervention or further assessment. So locate an advanced movement therapist local to you. And if you're a clinician who's interested more on how to assess and streamline and systematically approach your orthopedic assessments, head over to amtcertified.com and get certified today.